All right, so now we're going to look at the biomechanics of the spine, also the axial skeleton. So the axial skeleton will include the vertebral column. We've got 33 vertebrae, 7 in the cervical, 12 in the thoracic, 5 in the lumbar. Your sacrum is one fused piece. It's 5. It almost looks like fossilized vertebrae, so it has many of the same characteristics. Then your coccyx is it's separate but sort of a continuation of the sacrum. So it's attached with some connective tissue and really provides a connection for the filum terminalis. So the end of your spinal cord has a soft tissue structure that attaches into that region. The individual vertebrae provide the motion segment. So a motion segment is in between two adjacent vertebrae and includes all of the soft tissue structures, and basically what we see with the individual pieces is they articulate between themselves, and then of course when we just look at overall gross motion of the spine, it's really produced by multiple segments, so it's really difficult to single out any one specific segment. So this is just looking at an example. What we see here are basically all the components in between. So we've got the vertebral bodies, and then in between the vertebral bodies, if we're looking from the posterior, we'll have the spinous processes and ligamentous structures that attach the spinous processes. So we have interspinous ligaments and supraspinous ligaments. So this is a lateral view looking at the connection in between below the superior portion, and then of course on top of those as well is going to be the supraspinous ligament. The transverse processes, those are the ones that go out to the side, and that provides us also for connection of ligamentous structures in between the components of the transverse processes. Then we have an intervertebral disc. The intervertebral disc is going to provide the cushioning as well as give us some structure in between those segments. So they're actually going to be part of the motion here in between those two vertebrae. And then of course down in the center you've got the vertebral canal, which is where your spinal cord is going to be. So the two gliding components, the diarthrodial facet joints, so they're encapsulated and they look like another synovial joint. So they have a capsule to them. They're going to be filled with a fluid. So they have an articular surface and they have articular cartilage in between them. So those are the true diarthrodial joints that we consider to be similar to the other joint structures that we've talked about in the rest of the body. So they give us limitations, so they provide structure and support in the specific directions, so it actually sustains some of the loading as we see here, up to 30% of the compressive loading, especially in hyperextension. They're a little bit different from one segment to the next, and we'll look at that here in a second. The intervertebral disc, so that provides the cushioning. So inside of the intervertebral disc gives us the jelly of this jelly donut analogy. So the nucleus pulposus is this colloidal gel, very high fluid constituent, meaning it's a lot of water inside of there. And as we know that water that is made up in parts of the body, it really isn't all that compressible, which is why that it still provides a nice cushioning component. The structure of the spine, when we look at the spinal curvatures, so we've got the cervical spine, we've got the thoracic spine, we've got the lumbar spine, and of course we've got the head on top. And so the cervical spine is going to be one of the secondary curves. So that secondary curve comes after birth, so it's as the infant starts to pick up their head, and then the lumbar secondary curvature, the lordosis there, actually occurs as a result of initiating motion, or when they start to move. So the thoracic spine is the primary curve that we see in from birth. So it has that convexity to the posterior. So you can see here in the normal picture, the vertical alignment, that's considered to be normal, and then this is a lordosis, although some people refer to that curvature in the lumbar spine as a lordosis, but an accentuated lordosis would be considered at least a hyperlordosis. A kyphosis, also considered by some to be the normal thoracic curve, can be exaggerated, and that's referred to as a hyperkyphosis. And then scoliosis is going to be in the frontal plane, so it's going to be a sideways motion, or a sideways position, I should say, that affects usually the thoracic and the lumbar. So movements of the spine, very similar to what we see in the ball and socket joint, so it can move in all different planes. So we have flexion, we have extension, we have rotation to the right and to the left. It's in the midline, so we don't describe it as medial lateral rotation. It's either to the right or to the left. And we also have lateral flexion, so in that frontal plane motion going from side to side. And then of course we also have circumduction. Muscles that give us flexion of the cervical region, the rectus capitis anterior, lateralis, longus capitis, longus coli, and then all these hyoid muscles. So the hyoid muscles we see here that are going to attach to the hyoid bone. So it's kind of like it's just hanging out in space there, but does have ligamentous attachment and muscle attachment. So we're not as concerned with these when it comes to motion, although I don't want to downplay the fact that they are part of flexion moments, but we tend not to consider those too much in the analysis of normal human motion anyway. So some of our major players, the sternocleidomastoid here, that you can see crosses multiple planes. Very, very important muscle that gives us rotation, extension of the head, and then flexion as the spine as a complete unit. Looking from the lateral view, again, you can see some of these muscles as they attach to muscles for mastication, so muscles that are going to be involved in swallowing, muscles involved in chewing, and facial expression. So most of a lot of the motions that we're going to see are going to be coordinated motion patterns with multiple muscles involved in movements, and we'll see that there's going to be some overlap in some of the muscles that we looked at with the scapula that provide us with neck motions as well. So the sternocleidomastoid muscle, very, very important because it's a very powerful supporter of the head and neck, and you can see the scalenes named for anterior, middle, and posterior scalenes attaching to the spinous processes, and then the first couple ribs, prominent lateral flexors, and they also give us flexion to the anterior. Movements of the spine when we look at the thoracic and the lumbar, especially in flexion, the rectus abdominis, internal and external obliques. You can see from the picture here, basically we've got three different layers. So the most superficial layer is going to include a soft tissue structure and the external oblique. So the external oblique has as the name implies, it has an oblique orientation to it and gives us rotation to the opposite side. So if you're going to rotate to the left, then it's actually going to be your right external oblique, but when you do flexion going forward, it's bilateral contraction of the oblique muscles. Very similar with the internal obliques when you're contracting bilaterally. However, with rotation, it's the internal obliques that are going to give us rotation to the same side. Rectus abdominis is really right in the midline there, so it doesn't really give us any rotation, but does give us that flexion moment, and that's also, you know, the six-pack muscle that people see because it attaches to the pubic symphysis and the xiphoid process, lower ribs, and the sternum, and then the deepest layer is going to be the transverse abdominis.